A warm welcome to all my lovely audience. Today on Icy Tales, we're going to be having interesting discussions on lifestyle. Join me in welcoming Dr. Akshat Chadha, who is a lifestyle consultant and a doctor, as his name suggests. So, welcome, sir. How are you, and how does it feel to be
I'm very good. Thank you for having me. I'm quite excited to see what happens next.
here? Same here. So, with that being said, I think we should get started to get this exciting conversation on. So, can we get started?
Yes.
Cool, sir.
Yes, absolutely. Let's do it.
So while I was doing my homework, I was just seeing your Instagram. So I noticed your Instagram bio. It was very, very interesting because it said doctor with a twist. So I was really curious, and I'm sure our audience also is. So tell us what this statement means and why do you call yourself a doctor with a twist?
So Instagram always makes you put in the bio, right? So when I was coming up with thoughts, and it was like doctor with a difference, right? So as a twist just makes more sense. And the difference I would say was doctors have this really serious image, and it's like if you're going to a doctor, it's obviously for something negative, you've fallen sick or something not right, right? And when you come back, you will have a bunch of medicines, if not
Mhm.
more than maybe injections or something, or you get admitted, right? So I just feel that thanks to lifestyle medicine as my profession, that it gives me the opportunity to do things a little differently.
Mhm.
It gives me the opportunity to be a little more relaxed, less serious. I can, give good news and bad news to my patients in a
Mhm.
relaxed manner also.
Right.
And let's say at least 85 to maybe sometimes even 90% of my patients go back without medication. So I
Oh.
think that is one very big difference. Oh yeah, yeah. And then there is a small percentage who will go back with even lesser medications that they started off with. So fortunately, I am blessed to be in a profession which allows me that difference of actually reducing the seriousness, making it
Mhm.
easier for the patients to be get off medication,
Mhm.
try to go through sicknesses without really having to depend on medication. So
Mhm.
that's the twist. And of course, a patient recently pointed out to me saying that you have two meanings, sir. The twist
Mhm.
also is that you dance. So, so doctor with a twist is a dancing doctor too, right? So
Right.
there you have, it's a good pun on the word. So yeah, so doctor with a twist.
I'm glad to be having a conversation with a doctor with a twist. So great job on that. So like you spoke so much about lifestyle and everything. How important is it to maintain a good lifestyle?
It's become an entire profession. Lifestyle medicine is
Mhm.
actually, it's people are actually practicing it all over the world. It's not only India. So it's definitely important. But what we need to understand is what is this word lifestyle? Because
Mhm.
people tend to get confused because everything becomes a fad eventually. Inflammation, insulin resistance. Now lifestyle is also becoming a fad. But
Right.
people need to understand, okay, things like supplements and all of that is a part of your lifestyle.
Mhm.
But lifestyle basically means what you do every day. So you have your habits, which kind of come together and make a routine. So
Right.
this routine, which is kind of repeated over and over and over and again,
Mhm.
which is your natural routine, which feels
Mhm.
more sustainable, is
Mhm.
actually your lifestyle.
Okay.
So it's not just the medication or the supplements or just the exercise. It's a combination.
Mhm.
So how much you exercise? Do you walk? Are you moving more? Do you brush your teeth twice a day, once a day? What
Mhm.
food you're eating? What time you're eating? How stressed are you? Are you managing your stress? Do you sleep well at night? All of this are habits which come together, which give you
Mhm.
your lifestyle. It's
So that
extremely
is
important, right? Because eventually, what you do every day will define how fit and healthy or disease free you actually remain. So
right.
it's very healthy, very important.
Thank you so much for giving us that knowledge. Also, I was seeing your Instagram. You made so many reels about all these lifestyle topics. One thing which I noticed was something about PCOS. So it's becoming very, very common in women, and because of that, they are becoming very demotivated, and they are feeling very underconfident. So, what do you have to say about this, and what's your general opinion on all this?
So first, we need to understand that PCOS can come in different degrees. The
Mm-hmm.
intensity of the disorder also can be very mild,
Mm-hmm.
moderate, and then intense. So very mild people obviously can go even getting treated without any medication. Okay, moderate to intense, depending on what symptoms you're hit with, specifically irregular menses, missing menses, 6 months you're not getting menses. That could be a bigger problem, right? So
Mm-hmm.
of course, be open to the idea that small amount of medication might be required. So don't. So first of all, don't get distressed with the label. Oh, I
Mm-hmm.
have PCOS. So don't get distressed by a diagnosis. Don't get distressed by a label.
Mm-hmm.
Second is like be open to little amount of medication as and when required. Okay, there are currently, I am treating PCOS ladies with no medication. Yes, that happens, but not every woman can go without medication. Okay. Third is, whatever you decide, whether you're taking allopathy, homeopathy, Ayurvedic, your base, your foundation to get better is your lifestyle. So if you feel that you can therapy or any medicine without correcting your lifestyle, you're not going to get your desired results. So the good part is, it is as simple or as difficult. The way your mindset is, that lifestyle is as simple or as difficult. But if you do your part, if you do, I mean, exercise is a well kept literally correcting irregular menses. You do the right amount of exercise, don't overdo it, don't like 4 hours of exercise, don't overdo it either, but don't underdo it. You do exercise for 3 days and then you disappear for 3 months. No. So you do adequate exercise and do it in such a way that you're being consistent. And I'm telling you, your menses start to get better. So if you're ready to make a change, PCOS will just be a diagnosis for you, which will, I mean, your reports will get better, your symptoms will get better. So it's not the end of the world at all. You can use it as a reason. You can use it as a reason to actually live a better quality of life.
I think all what you spoke really did make a lot of sense, because in today's world, people are, getting a lot frightened because of this issue, but you just threw positive light on it. So I'm glad you're doing such good things for today's women. Great job on that, sir. And this brings me to my next question automatically. You spoke about exercise. So how important is it to practice good nutrition methods?
Very important. So when I talk about the 4 pillars of lifestyle, so one is your nutrition and hydration, your water intake and what you eat, right? Second is exercise. Third is your sleeping patterns, and fourth is how you manage your stress levels. Okay. There is the fifth parameter, which is addictions, and there's sixth, which is of course how many medications you're on. But when you talk about lifestyle, the first thing that comes to people's minds today, because everybody has accepted that food can be medicine. Food doesn't have to be medicine, but it can be also. And if you just correct your eating habits, half of your problems will get sorted. The problem is that it's not only what you eat, it's how you eat, how much you eat, when you eat, and a lot of times why you eat. Because I think emotional eating is one of the biggest problems that even I face with my patients, right? And we live in a day and age where you can get food delivered on the press of a button. It is literally at the press of a button, right? So if you're upset, oh, I want a brownie, I'll call for it. If you're sad, I want a gulab jamun, I'll call for it. I'm very happy, I want a cake, I will call for it. I want to have a pasta, I'll call for it. So it's not that it's these things, of course, they will fall into the unhealthy category, but I have a different mindset when it comes to food. I always feel that you shouldn't really break it down constantly on healthy, unhealthy, healthy, unhealthy, because that's what we're absorbing, right? So every time you're eating even a pizza which is unhealthy, our mind is constantly reminding us that's unhealthy, 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 right? So every time we eat it, half the times people come out and say guilt. I regret eating it. I shouldn't have eaten it. There's so much of guilt. And then the next 2 days, they're literally just going through that guilt. So I think that it's very important to change your relationship with food. And one strong suggestion is that packaged food. Packaged food, I think we talk a lot about sugar. But the biggest problem with packaged food is it's not only sugar, it's salt, it's preservatives.
Yes.
Sugar additives. Right? So it's full of things that you shouldn't be consuming. So today we live in a fast, convenient world where we want everything at the fingertips. So I don't care. I don't want to take out time to prepare for my meals. So I'll just go get a protein bar. Now, obviously, if we constantly are living like this, we are headed for trouble, right? We need to have good home cooked, clean food, and that's the solution of most of our problems. So yeah, so food is right here because there are a lot of ways to slip away from it.
I like how you broke down everything into step by step, so it made it so much easier for people to understand. So I'm sure all those watching this will have major takeaways. Good job on that, sir. And being a lifestyle consultant, I'm sure you would have had so many times when you felt like it's a good job and it's a bad job. So what is your most favorite thing about being a lifestyle consultant?
So like I said, the twist is my favorite thing. The difference is a favorite thing. Okay. But the fact that I can take people off medication, reduce medication, I can prevent people from going on medication. Of course, the negative to this is that I want the patient has to be, in conjunction, in sync with what I'm saying, because I can tell them to exercise, but if they don't do it, they won't get the result, right? So it's a two-way communication between me and my patient. But the best part is that I get to prevent medications for a lot of people. If I can prevent even a round of antibiotics, I can do that. Sometimes there are people who are unnecessarily prescribed antibiotics, or the worst case scenario, people self-medicate with antibiotics.
Yes.
4 साल पहला, 5 years back, someone had given him some antibiotic for cold cough and they got better. They still have that parcha, that prescription, and they will keep taking it every year. So a lot of my patients also do these habits. So if I can prevent them from going on antibiotics, I'm very happy. But there is one more thing that I love about my job, is that I get to people welcome me. I get to listen. I get a lot of stories. I get a lot of listening, because I need to get into their day, what is happening, and why are they not able to do what they're supposed to do, right? So it's very welcoming that they tell me so much. I get to listen, so I get a lot of understanding of them. So I mean, it's my conversations are very warm. At the end of the consult, it's very warm, because I've gotten to know the person a lot more than a conventional doctor might know. So lots of advantages of my job.
And you're happy with it. So at the end of the day, that tops the list above all. So again, very happy.
Yes.
Yes, and I'm
But I mean,
sure.
there can be some days where it gets a little painful. It does to absorb. You have to filter what you absorb, and not every case is very straightforward, right? And not every patient is as cooperative as you would like the patient to be, because if a follow-up comes back and they've not done anything, then it is a little disheartening even for me as a doctor. So everything has its pros and cons.
That was exactly my next question on how do you deal with times when you feel low and when you don't achieve what you want?
So see, I mean, it's one is a personal kind of an achievement, and then there is family achievements, and there's societal achievements, and there's patient achievements, right? So bottom line is, I think the first thing that I tend to do, so I'm quite an analyzer, organizer. I like to kind of break things down, right? Like you said, I break things down. So first, most important, and I do tell my patients to do this, is I find the trigger. Like, why am I feeling low? Why am I demotivated? What is it that is making me feel this way? Okay. Second is, I accept the feeling. A lot of people nowadays, the problem is not about feeling low. Nowadays, the problem is the pressure of feeling low.
Yes.
How can I feel low? How can I feel sad? I am supposed to be positive all the time. This is not allowed. Okay. So I always tell everybody, and I tell myself, I am allowed to feel low. I am allowed to feel demotivated. I am absolutely fine if I'm sad 1 day, 2 days, 3 days. That's okay. Okay. So second is, I accept the feeling. So I try to understand it. I try to accept it. Then there are things which I feel are easier to do. There are things like, in my day, if I have 20 things to do, I will pick and choose. On a demotivated day, I'll pick and choose something which I'm good at, which feels easier for me to do. So I'll do that first.
Right.
Because if I manage to do that, it makes me feel productive. It makes me feel a little good about myself. I've not solved the problem yet, but I've still done something to feel a little better. So then it kind of picks up. And then obviously, if nothing is working, then two things. One is music. I really love music. And second is my wife. She will listen to whatever I have to say. And she's a very different person. She will not give me a solution immediately. She might give me a solution also, but she listens. So that's my eventual resort. Sometimes I go to my wife after everything I have solved also, and then I go and tell her also. That's another form of happiness for me. So either way, so expression at the end of the day does happen.
Indeed it does help, because I've also faced situations like that, and when I express, this whole thing just solves immediately. So very great to know that. Let's move on to our last question, which is a very fun question. I'm sure in your journey you would have had so many experiences which were out of the box, which were funny. But I'm going to ask you to tell me one experience which inspired you in some way and brought out a change in you. Is there any experience like that?
So there's no one single experience, to be very honest. I am inspired by my patients almost every day, because I consider myself, touch wood that way. Like, for example, small example, I don't even have kids, right? So when I have a single mother coming to me who has diabetes, and she's taking care of herself and her children or her parents, that's motivating for me. Okay. Then if I have a mother who comes to me or a father who comes to me who has type 1 diabetes or type 2 diabetes, their child also has type 1 diabetes and they
Yes.
are ready to make a change. And I see them literally going through what I am telling them every day, and they're really making it happen for themselves.
Yes.
That's very, very, very inspiring for me. Okay. I have, so if I have transgender patients, right, who are looking for a change of their, the sexual orientation, right? So they, I mean, they are the ones who motivate me every day because they go through a lot. They go through a lot, not only within themselves, there's so much of confusion within themselves, but when the society, or forget the society, their family doesn't accept, who they are and what they
Mm-hmm.
are. It is one of the most disheartening. Like, so recently I had a patient recently, and that's why it came to my mind.
Mm-hmm.
And she has gone through hell, she's gone through hell. And now, after literally 2 years, after 2 years of her hard work and everything that she's done for herself, her parents are accepting her. So
Oh.
when I, get to hear this, that finally it is paying off. I mean, of course there are times where it doesn't pay off so quickly also. Yes, I'm saying so quickly for 2 years.
Mm.
But people don't give up. People just don't give up on themselves. People don't give up on health. People don't give up on world. People don't
Mm.
give up on goodness. So, like, if you go through a negative experience in life, people have a lot of traumatic experiences, sexual abuse, physical abuse. They go through it. They know people who live in toxic environments, but they're still living, but they don't give up on goodness. I think that is something which inspires me, motivates me almost every day. So there's no one experience. My patients are full of experiences. So that way.
And this was the perfect way to finish this conversation because we ended this on a very positive note, and I'm sure everyone watching this would have got inspired and enlightened. So